Good afternoon, everyone. Thank you for joining us for today's QC COVID-19 press briefing. It is Tuesday, March 30th. I'm Brooke Barnes with the Scott County Health Department. With us today, we have Nita Ludwig, Administrator of the Rock Island County Health Department, and Amy Thoreson, Interim Director with Scott County Health Department. We're going to go ahead and get started today with some of the stats we have for both counties. We'll start with you, Nita.
Sure. Today in Rock Island County, we have 22 new cases of COVID-19, and that brings our total to 13,412 cases. We do have 19 people currently hospitalized in Rock Island County with COVID-19, and our deaths remain at 307 for Rock Island County.
In Scott County, there have been 19,275 positive COVID-19 tests, and unfortunately, we've had 226 deaths. In more good news, in Scott County, 80,200 vaccines have been given, and 27 fully vaccinated.
Nita, do you want to provide us with today's prepared information for Rock Island County?
Sure, thank you. For some of the good news, the Rock Island County Health Department and our partners have given more than 61,000 doses of one of the 3 COVID-19 vaccines, and more than 21,000 people are fully vaccinated, and that is 15% of our population. Now for some of the sobering news, we are seeing rising case counts on both sides of the river, especially in younger people. The Illinois Department of Public Health put Rock Island County in warning status last week because of the rapid rise in cases. Right now, there are no additional mitigations in place because those are enacted when on the regional level, but other counties in Region 2 are also seeing rising cases. And because of all this, the Rock Island County Health Department opened up the vaccine eligibility to every Illinois resident who is 16 years and older this week. With this change, we want to remind you of some vaccine and procedure basics. Our vaccine supply is primarily Pfizer and Moderna. We do not know when we will start to receive any larger quantities of Johnson & Johnson. Remember that the best vaccine is the one that is available to you now. Pfizer has been given emergency use authorization for those that are 16 years and older. For Moderna and Johnson & Johnson, the age is 18 and older. The second dose of Pfizer vaccine is normally due around 21 days after the first dose, and the second dose for Moderna is about 28 days after the first dose. You must have the same brand on both doses. Johnson & Johnson is only 1 dose. And don't fret if you can't get an appointment on that same exact 21 or 28 day mark. You do have 42 days after that first dose to get your second dose of either Moderna or Pfizer vaccines. And just get it as soon as you can after that. The Illinois Department of Public Health keeps track of the number of first doses given in our county, and then they allocate the matching number of second doses. We have thousands of appointments available each week at our National Guard Clinic at the Camden Center in Milan. To sign up, please visit our Facebook page or our website, richd.org, for the links. You will need the voucher code that goes to the appropriate link to be able to register. You are considered fully vaccinated 2 weeks after your second dose of the Moderna or Pfizer vaccine, or 2 weeks after the 1 shot of Johnson & Johnson vaccine. And after being fully vaccinated, you can gather indoors with fully vaccinated people without wearing a mask. You can gather indoors with unvaccinated people from one other household, for example, visiting with relatives who all live together without masks, unless any of those people or anyone they live with has an increased risk for COVID-19 illness. If you've been around someone who has had COVID-19 and you're vaccinated, You do not need to stay away from others or get tested unless you develop symptoms. Until we reach herd immunity, and we don't know what percentage that is at this moment to be vaccinated to get to that point, we must continue to wear masks and social distance in public. Washing your hands frequently and staying home when you're sick are always good public health measures to take. Illinois will remain under a mask mandate until the CDC recommends that it can be over. Expect these practices to continue at least until late summer this year. Thank you.
Iowa has not yet opened eligibility to all adults who would like to be vaccinated. We are expecting an announcement from Governor Kim Reynolds later this week regarding whether or not the vaccine supply coming into Iowa has increased enough to open eligibility to all adults on Monday, April 5th. Please stay tuned to the news and our website for the latest updates once they are shared. As with every transition in vaccine eligibility that has taken place, we expect there will be a rush to find vaccine on the first day that everyone becomes eligible. We ask you to be patient and know that you will get an appointment. It just may not be in the first few days. We too anticipate that Pfizer and Moderna will continue to make up a large percentage of the vaccine available. To be fully vaccinated with one of these, an individual needs 2 shots. Please plan to schedule both of your shots with the same provider, whether it's through a local healthcare provider, local pharmacy, or potentially even our health department. It's not as easy to find a second dose if you're looking somewhere other than where you received your first dose. Save yourself the work and frustration. Vaccine providers in our community are doing their best to schedule you for both doses. If you cannot make your appointment, please let the vaccine provider know. We shouldn't be able to recognize who is vaccinated as they walk down the street unless they're wearing an "I got my COVID-19 vaccine" sticker. Even the vaccinated among us should continue to distance and mask, especially when in public locations. Put it this way, we need a full court press to shut COVID down. We need it right now as our daily cases and positivity rate increase. We know that more people are getting tested and more of those tests are coming back positive than they had over the last month. We are hearing that the number of people hospitalized is also starting to increase. The most frustrating and yet the most comforting thing is that we have the same 4 tools at our disposal to help us reduce and keep the spread of the virus low. Wear a mask, keep your distance, stay home when you're sick, and wash your hands. I know that everyone is tired of hearing those words. I'm tired of saying those words, and we're all tired of following them. But the only way we can truly fail is if we stop trying. Please continue to do your part. Thank you.
Thank you, Amy and Nita. We do have a couple questions. I'll start with the one here in the chat, and then we did receive one earlier. Nita, did you see an uptick in appointment signups yesterday after the eligibility announcement?
Yes, we did. I'm happy to say that today was pretty much booked full, and tomorrow and Thursday are full as well. We are offering Pfizer on Friday and Saturday, and those are completely booked. We expect to put out new links and new posts for next week's appointments, probably Thursday afternoon or Friday morning. So we really encourage people to check our Facebook page or our website for that.
Nita, another question was related to the warning level that's received for Rock Island County. It looks like the data for the week of March 13th to the 20th shows 4 COVID-19 deaths. And do you know how the state is calculating that based on maybe some data that's here locally as well?
Sure, we are aware of that discrepancy in the last week. We have reported only the 1 death this week, and we do verify the deaths with our county coroner and also with our vital records staff here at the health department. So we are not particularly clear on the state's number. They could have a lag, or they could be getting some information from out of state that we have not been given yet.
And then both for Amy or Nita, question about what we're hearing about laminating your vaccination cards. Some stores are offering free lamination. Should you do it if you need to write booster dates on them? I'm assuming there's a question of do it between your first and second or after your second if you believe you've received your full vaccination. Do you want to start with that, Nita?
I guess I will, yeah, since my face is up there right now. I would not recommend doing it until at least after your second vaccination, if you're getting the Moderna or Pfizer. We have really no information yet about boosters or when that might happen. So if you want to laminate it, I would wait till you're fully vaccinated, either the 1 dose of Johnson & Johnson or the 2nd dose of Pfizer or Moderna.
I would just also add that the vaccine information is being entered into state vaccine databases. So if in 2 years you need a copy of that vaccine record, you'll be able to get it from the state where you received your vaccine. Or if you wash your card in the laundry because you put it in your pocket, we can still get you those records. So there is a permanent record that is in the state immunization registry.
Last question is about contact tracers. Then with the state doing Scott County still at this point, Nita, maybe you can give some insight here. What are contact tracers and others hearing from patients and their families? What are the main misconceptions?
Main misconceptions. I think that we're hearing, people are becoming a little bit lax. Just like Amy said, it is not time to let our guard down. We still need to social distance, wear our masks, and wash our hands. Even if you've been vaccinated, we still need to do that until we get to herd immunity.
Thank you both. Okay, it looks like that was our last question that we've received. So we will go ahead and complete today's briefing. So thank you all for joining us. Thank you, Amy and Nita, for your time today. We will again continue with the once a week briefing. So we do intend to come back and talk with you again next week. Should there be anything between now and then, please look for information to come from both of our health departments. Thank you for your time and have a great afternoon, everyone.